Squeezing the finest minds to extract the purest science? Welcome to Juisci Interview.
Welcome today, Derek Webb. I am Sasha Romary, and I am the Director of Customer Experience here at Juisci. And we are here with Derek. So you are a community pharmacist with decades of experience in advancing public health. Not only do you serve as a member of the Virginia Board of Pharmacy, but you are also an elected official and legislator and a previous mayor of Abingdon, Virginia. Your work has spanned over community health, regulation, and civic life, always with the goal of improving access to safe, effective, and affordable care. Is there anything else that I am missing that you would like to add, Derek?
Not particularly. I wear a lot of different hats, but yeah, that pretty much sums it up.
Wonderful. Great. Well, let's maybe begin with your journey. What first inspired you to pursue pharmacy, and how did that career evolve into broader leadership roles from the Virginia Board of Pharmacy to public office? Tell us a bit more.
Sure. So my journey as a pharmacist probably a bit unorthodox. Not a lot of pharmacists move into that legislative field, but there are some others out there. But having said that, I always wanted to contribute in healthcare in some capacity. I wasn't really sure in what capacity, but I knew I wanted to help people. I wanted to be a public servant, and I always admired pharmacists. I felt like they were just great examples of leaders in the community. They were pillars of the community. You see a lot of pharmacists with a lot of benevolent acts of kindness. They really and truly live in and contribute to their communities. So, having said all of that, I became a pharmacist, and absolutely no regrets there. It's a great profession. It's a great fit for me. I started out in community pharmacy as a community servant and practiced for a few years and decided that I had more to give. I wanted to achieve more. I wanted to give back to the community in a greater way, with a larger footprint and a more, I guess, just significant way. So I decided I was going to run for public office. And you never really know how you're going to be perceived as a public official. But I was met with an overwhelming show of support. I was hugely successful in my first attempt at office, which just goes to show you that community pharmacy is a great platform for politics if you choose to go that route. Having said that, being an elected official isn't a whole lot different than being a community pharmacist. You're still putting out fires, trying to find resolutions, trying to find ways to take care of the community. So I really thrived as a public official. And after a few years of serving in my capacity as a public official, I thought, what can I do now? So I decided that I wanted to try to achieve the highest elected official position within the region, which is the mayor. And again, I put a bid in for the mayor, met with overwhelming support, ipso facto became the mayor, and truly just relished in my time as the mayor, working in a PR capacity for the community, getting a higher level of advocacy for pharmacists in general, and showing people that there's all sorts of things you can accomplish if you put yourself out there. So I served as the mayor. Enjoyed that tremendously. Again, realized I was good at it. Not all that different than being a community pharmacist, still putting out fires, finding resolutions, finding ways to take care of the community with just a greater significance. And after being the mayor for a few years, I thought there has to be something more that I can do for the pharmacy industry. So I decided that I was going to advocate for being appointed to the Board of Pharmacy. And was successful with that. Was appointed to the Board of Pharmacy a couple of years ago. And if you're not familiar with the Board of Pharmacy or how that works, in the state of Virginia, in the Commonwealth, we have 8 pharmacists across the entire state. We have 2 citizen-elect members, and the 10 of us comprise the Board of Pharmacy, which basically shapes the policy for how pharmacy can be practiced in the Commonwealth. So again, I've taken on some various roles at the national level since then, but truly enjoying my journey. As I said, it's a bit unorthodox, but has been very, very fitting for me.
Wonderful. Thank you so much for sharing that. I have lived all over the world, but spent 4 very formative years living in Virginia. So it's very cool to
Fantastic.
hear how this works, kind of in that state. Um, so it sounds like pharmacy and civic life often intersect in your work. And I'm curious if your perspective as a practicing pharmacist, how that influences your decisions as a regulator and an elected official, and if so, kind of how.
Sure. Absolutely it does. Pharmacists are one of the most accessible healthcare professionals there are. We're right there on the front line in the community pharmacy world. So I feel like, again, I said it's a great platform, but it's also a great place to gauge the pulse of the general public, keep your finger on that pulse. You can almost predict what the public needs, what they desire, from being on the other side of that counter. Being a community pharmacist, you get all sorts of different perspectives that come across, and they give you feedback, and that's what you want as an elected official or as an appointee. I always tell people in municipal meetings as well as board of pharmacy meetings, there are sections outlined for public comment and public hearings, and those things aren't there just to be there. They're there on purpose so that the general public and your constituents have an opportunity to come forward, give their feedback on what we're doing. So we want that feedback. We want the perspective from those different groups of people so that we know we're doing a good job. I take my roles very seriously. As an elected official, you're elected and put there to enact the will of the people, right? So I take that very seriously. On the regulatory side, you're appointed and put there in the state of Virginia to protect the health and safety of the Commonwealth, right? So I take those things very seriously, and without unbiased, just critical feedback from the community and the populations that you serve, I think it's difficult to make those decisions. So we want your feedback. We want you to come out, and it truly does shape the way we craft policy and allows us to create the best policy that we can create.
I love that. You advocate a lot for patient education. In your opinion, why are community pharmacies so important for this?
There's a number of reasons why community pharmacists are so important for patient education. But you got to remember first and foremost that patient education is critical if you want to deliver the best possible health care across the continuum, right? So we, as pharmacists, as I mentioned earlier, we're poised and we're in a unique position because we're right there, feet on the ground. We're actually behind the counter waiting for people to come through. We see so many people on a daily basis. We're so accessible. We're one of the most trusted healthcare professionals. So we play a very vital role in the patient education arena. Again, pharmacists are in a position where we can meet them head on during their journey through healthcare. Sometimes we're the last person they see in a very long day of healthcare where perhaps they've been dealt some really bad information. Maybe they figured out they had a terminal illness. Maybe they figured out they had cancer. They come to the pharmacy as their very last stop. It's a very vulnerable place, and if you think about it from that angle, how powerful of a position are we in as community pharmacists where we can actually shape and help dispel some of the rumors and help these patients in this very vulnerable state to figure out where they go moving forward? It's just a really special place to be in. A lot of pharmacists probably don't think of it that way, but it is truly just a very critical point in that healthcare system and the healthcare process. We can be there on the other side of the counter, if nothing else, just to dispel rumors, to try to figure out what is accurate and what's not accurate, to help guide these people on how and when to use their medications. It's just an incredibly vital role in that healthcare process. And I'm proud to be a pharmacist on the community setting and be able to provide that service.
I love that, and I can see, just hearing you talk, I can see, and even seeing your facial expressions, I can see how really passionate you are about that work. Wonderful. Well, you've worked on regulation and policy now for many years. What are the most pressing challenges in pharmacy practice today? And how can regulators and legislators help address them? Could you maybe share an example where your kind of dual roles as a pharmacist and a policymaker have come together to create some tangible improvement for patients or the profession?
Sure, sure. I think the two most pressing issues that come to mind for me aren't really unique to pharmacy, but in a way they are. And it's a very simple concept. It's the lack of time and the lack of money. Those are the two things that come to mind. And by time, I mean, community pharmacists strive to offer the best possible healthcare, the highest level of healthcare that we can offer. And unfortunately, over the past few years, that has deteriorated to some degree because we just don't have enough time to get all of the different tasks done that we have in any given day. The money side plays into that, unfortunately. Reimbursements have been at just all time lows for the past couple of years. And anytime that bottom line moves in a negative way, it basically prevents us from being able to justify hiring more staff and creating more time, right? So it's a vicious cycle. On the money side, reimbursements being so low have driven a lot of independent pharmacy owners out of business. And when that happens, it creates what we call a pharmacy desert. Pharmacy desert being an area, whether it be a county or just a distinct geographic location, in which there may not be a single pharmacy to service those customers. So what happens is the lack of money drives these customers over to the other pharmacies, which are already overly busy, and they have more work than they can do and not enough time to do it in. And it just continues to precipitate a vicious cycle. Again, it prevents us from being able to hire adequate staffing. It prevents us from being able to service that highest level of care. Now, the good news, and I see this firsthand on my end, from a legislative perspective, policymakers have started pushing bills through that are going to help with the reimbursement. So I think the good news is coming. Better reimbursements are coming. It's just a matter of time. And then on the regulatory side, many boards of pharmacy, including Virginia, we've enacted what you call workplace condition restrictions. So those workplace condition restrictions and regulations, they pretty much encourage the owners of these pharmacies and the people who manage these pharmacies to make sure they're adequately staffed so that pharmacists have enough time to be able to offer a certain level of service. Now, again, it's not perfect. We all strive to do better. But if we had more time and more money, which everybody would probably say that would help, then I do think it would solve a lot of issues that we have going on in the industry.
Yeah, that definitely sounds like some big steps in the right direction. Um, and I think many of these pharmacists feel quite far from the policy table. And so my next question is, how do you see pharmacists engaging more effectively in public health discussions and in the legislative process?
One of our issues, and I say issue, it may not be the right word with pharmacists across the US and maybe worldwide, is there are far fewer of us than there are of other healthcare professionals, right? There's many more nurses than there are pharmacists. I mean, many, many, many more. So what that does is it doesn't allow for enough people to have seats at certain tables. And you've heard the old saying that the squeaky wheel gets the grease. Well, that is very true in politics. That is very true in regulation. If people don't tell us what's going on and what issues they're having, then oftentimes we miss that picture altogether, or at least we're not sensitized to it in a significant way. So, I think the first and foremost, we as a profession, we as pharmacists really have to take that initiative to step up, move into different roles across the spectrum. As I said before, we need more seats at the table, but we also need people who are willing to step up and fill those seats. And I always tell my students that, how do we eat an elephant? Well, the answer is one bite at a time. It's small steps, right? So we have to find ways to create incremental gain. Pharmacists taking on different roles, moving into advocacy roles. Part of that is really being involved with your local, state, and national pharmacy organizations. People fail to realize that if they don't join these groups and they don't give them their money, then these groups can't advocate in a meaningful way. They can't afford to lobby. They can't afford to really move the needle on any of this legislative action. So I think just pharmacists recognizing that they have to step up, they have to do more in their profession if they want the profession to remain solvent and they want us to be able to make a decent living. Now, I will, having said all of those things, I will say historically, over the past couple of decades, we haven't had a real strong presence, but I do think things are getting better. I do think that pharmacists are realizing, just like myself, that you have to put yourself in a position where you can truly make a difference. So I think we have some momentum moving forward. And I would just encourage any pharmacist that watches this to make sure that you take on that initiative. Try to move that needle and do what you can in your own way to fill one of those seats.
Mm, perfect. Yeah, definitely. I think the collective voice is louder than the individual, but the
Absolutely.
individual is still a voice.
That's it.
Wonderful. So, as a pharmacist, you keep up with medical literature, I imagine. How do you balance evidence based clinical decisions with the practical realities of policymaking?
Sometimes that's hard. As a pharmacist, I see evidence-based medicine as the foundation for sound clinical decision making. Put on the legislative regulatory hat. And I realize and recognize that policy has to be viewed from a much wider angle, from a broader lens, if you will. So evidence tells us that certain things should work in a controlled or a perfect environment, whereas policy kind of delves out and determines what can actually work within real world constraints. So, cost, accessibility, the amount of workforce, et cetera. So, anytime that I evaluate any new literature or guidelines, I first ask myself, how does this evidence apply to the real world? Is it reproducible? What are the outcomes with this particular set of evidence? And then when I translate that in policy, I actually asked myself, well, how does this affect the providers, the patients, and really just that healthcare system as a whole? What is the impact there? And sometimes, if you think the most clinically elegant solution that's out there just isn't something that we can easily implement. So I always tell people, imagine a scenario where there's this disease that pops up and there's this just really fantastic new drug out there that treats this disease and it's just a great solution. But when we delve into the detail and the minutia, you realize that number one, the drug is incredulously expensive. It's not covered on formularies well. And then there's availability issues on top of that. So those things really do happen. And therefore, that particular drug, although it sounds just wonderful, may not be a good solution at the time, right? And ultimately, I see myself as a regulator, legislator, and a pharmacist. I see myself as being kind of a bridge or a conduit between that evidence that we talked about and how do we implement that evidence? And that's really kind of how you have to look at both sides of the equation.
Yeah, that sounds like a very important connector to all of those areas.
Sure.
So as we get to the end of this lovely interview, if you could share one clear message with your peers in pharmacy, but also policymakers and the public, what would that be?
So if I had one clear message for my peers, policymakers, and the general public, I think it would be something to this effect. Good, sound healthcare policy begins and ends with the patient. And it takes all of us working collectively, working together to make sure that the scientific evidence, the cost, the access, and the compassion are all aligned throughout the process. As pharmacists, we're trained to follow evidence. We want to know what works, how it works, and why. And in this particular situation, evidence really isn't enough. It takes more. It takes policy that is sound, that makes sure that the scientific evidence and the accessibility and the sustainability are all there. And furthermore, and maybe most importantly, that the general public embraces and utilizes whatever system it is that we create, right? And at the end of the day, I think it's important to remember that every decision we make, whether it be in a regulatory fashion or in a room full of committees, or even just behind the pharmacy counter, every decision we make affects someone's life, it affects someone's health, their well being, and it affects their family. So, at the end of the day, I think my message is this: let's keep patients at the center of everything, every decision that we make. Let's make this thing patient centric. And remember that healthcare works at its best when policy, evidence, and people move forward in the same pattern.
It's a really powerful message. Thank you for sharing that. And finally, let's end on a lighter note, as we like to do in these interviews. If you had to choose, are you more blueberry juice or juice of science?
I love it. I like all juices, but the juice of science is definitely my thing.
Wonderful. Well, thank you, Derek. It was a real pleasure having you, and looking forward to seeing all of the exciting things that will come in the next chapter of life with you.
Thank you so much.